Good afternoon, and thank you for joining us today for the latest update on the 2019 novel coronavirus, or COVID-19. As of 12 a.m. this morning, we have 1,579 new cases of COVID-19. This brings our statewide total to 14,599 Pennsylvanians who have tested positive in all 67 counties. Approximately 664 of our total cases are now in healthcare workers, and 674 of our total cases are in long-term care living facilities, including nursing homes and personal care homes. Tragically, we have now had 240 deaths among those who have tested positive for COVID-19. And to date, all of our deaths have been in adult patients. As of noon today, hospitals are reporting that approximately 1,665 patients are currently hospitalized due to COVID-19. This is about 11% of our total case count. 548 of those patients that are hospitalized require the use of a ventilator or a breathing machine. Across our healthcare system in Pennsylvania, approximately 51% of hospital beds, 40% of our ICU beds, and nearly 70% of our ventilators are still available. Today, I would like to echo the words of First Lady Frances Wolf and her call for volunteers during this very challenging time. Volunteers are essential to distribute meals, donate blood, and help with other life-sustaining activities for so many in our communities. Even with the statewide order that the governor and I have put in place, volunteering is considered an essential life-sustaining activity. Now, there are several ways that you can volunteer. You can connect with organizations within your community, such as the Red Cross or faith-based organizations. Or you can visit serve.pa.gov. This is the Commonwealth's online registry for medical volunteers and non-medical volunteers. You can connect with PA 211 through the United Way to find organizations that are looking for volunteers or to post your volunteer needs. As the First Lady, Ms. Wolf, said today, ensuring that Pennsylvanians continue to have access to food, medical services, and other essentials remains a priority for the entire Wolf administration. And thank you to all of our residents in advance for your willingness to help and continue to ensure that we have a healthy Pennsylvania for all. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or of course the time it takes to sing Happy Birthday twice. And use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands, and try not to touch your face, and especially when you touch surfaces, and clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. Practicing these everyday prevention measures can help slow the spread of the dangerous virus, COVID-19. If you have questions about your health, please contact your health care provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741, or call the statewide support and referral helpline at 1-855 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response to COVID-19, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember, stay calm, stay home, and stay safe. And now I'm pleased to answer questions.
Thank you, Secretary. Our first question is from the Philadelphia Inquirer. Can you comment on the importance of medical marijuana to those with serious medical conditions amid the COVID-19 pandemic?
So the medical marijuana program is still open and functioning. Medical marijuana is exactly that. It is medicine to people with up to 23 serious medical conditions in Pennsylvania. And so it's very important for these patients to be able to access their medicines. And so the medical marijuana program is functioning completely normally.
Secretary, from the Tribune review, is there a lag in reporting new cases and deaths from the weekend? Tuesday has consistently seen a large jump like today, and given that the state is getting its numbers at midnight, is it possible that Tuesday's numbers always seem a bit inflated because it includes numbers from the weekend that weren't counted in Monday's report?
So I wouldn't use the term inflated, but yes, there is sometimes a lag time for the reporting of cases and particularly deaths into our data system. And so sometimes on Tuesday we see an increase reflecting that lag time over the weekend.
As a follow-up from the Associated Press, do you expect the dramatic increase in deaths to continue even if the number of new cases plateaus?
Well, today's significant increase in deaths is particularly due to a lag time in terms of reporting into our system. We know this. We would, however, expect that there would be increases in our number of deaths as the number of new cases plateaus and then hopefully goes down. And that would be due to serious illness in patients that had already been diagnosed. And this has been seen in other states. So we're going to be tracking all of those statistics very closely.
Secretary, we have several questions around the start of trout season from KDKA, from WTAJ, from WPXI-TV, the Daily Press, and the Philadelphia Inquirer. In terms of trout seasoning opening today, it usually draws big crowds. Do you think it'll be possible for people to fish while practicing social distancing? And how do you recommend people fish safely, particularly in the historic crowded opening days?
So we have been in discussions with the Fish and Game Commission about the start of trout season. And so today was actually a soft start. They didn't have the big events that they usually have, particularly so people could practice social distancing. Of course, trout fishing is an outdoor activity, and as was described to me, the way that trout fishing goes, usually it's by naturally would have some social distancing, and so that's why trout season was allowed to start and will continue, but it is very important that social distancing be maintained.
Secretary, we have several questions about nursing homes. First, let's start with WGAL and Penn Live in terms of what's being done to protect patients and staff at nursing homes and long-term care facilities, and an update as to how many nursing homes have at least one positive case.
So there are significant increases in the number of nursing homes that have at least one case. I actually don't have that statistic at my fingertips, but we are seeing that increase. And nursing homes and other long-term care living facilities remain of significant concern to us, with vulnerable populations of seniors and those with other chronic medical conditions. So we are doing everything we can to protect the staff and the patients in those long-term care living facilities. We have put out specific guidance for those facilities. There's also guidance from the federal government and the Centers for Medicare and Medicaid, or CMS. In addition, we have contracted with a company called ECRI, and they will be providing consultative services, virtual consultative services to nursing homes to discuss infection control procedures and education. So we are watching the nursing home situation really, really carefully, and we have already asked ECRI to do virtual consultations even today.
Secretary, as a follow-up to that from KDKA and WPXI, questions regarding a specific facility in Beaver County called Brighton Rehabilitation and Wellness Center. They're saying that they are shifting away from counting test results after consulting with the department. Can you confirm that we issued that guidance and agreed to the guidance to assume that all patients and staff are confirmed positive with COVID-19 in that facility?
So I'm not going to discuss a specific facility for privacy and confidentiality purposes, but it does bring up an important point, and that is the point of probable cases. And so if there was a significant outbreak in a facility, or if people at a home, at least one person in a home were positive, other individuals who develop symptoms in that facility or in that home could be what are called probable cases. If they have mild symptoms, there's really no necessity to test them. Of course, if they start to have significant symptoms and require medical treatment, then they would go to a hospital to be assessed and to receive that treatment, and then the hospital would decide upon testing. But that idea of probable cases is something that we are working on.
Secretary, we have a couple of questions about underlying health conditions on top of COVID-19 and death reporting from WHYY and from Fox 43. Are we breaking down deaths or cases by comorbidities? And of the 240 deaths, do we know how many of those folks have had underlying health conditions?
Mm-hmm. So I don't have specific information. It does require a lot of time to investigate each death to find out about comorbid conditions. But in general, yes, we are seeing significant increases in deaths of those with significant comorbid conditions. Those could include heart disease, chronic lung disease such as chronic obstructive pulmonary disease, chronic kidney disease, and diabetes. And actually, a number of patients have had a number of different comorbid conditions at exactly the same time.
Secretary, from the Tribune review, would you consider releasing the age breakdown of coronavirus deaths like you do with total cases and hospitalizations?
So we're always looking for different ways to present our data. So there's information for the media and for the public. So we will consider that. What I can tell you is that most of the deaths have been in seniors 65 and older.
Secretary, from Penn Live, New York Governor Andrew Cuomo said Tuesday that the state's Department of Health has developed antibody testing and is working with the FDA to bring it up to scale, and is also working with New Jersey and Connecticut to ensure we move forward using a regional approach. Is Pennsylvania involved in those conversations? And if not, is the Department of Health in Pennsylvania working to develop its own test?
Mm-hmm. So we have not been involved with those conversations with those other states. And the Pennsylvania Department of Health wouldn't be developing its own tests. But we would be working with laboratories to buy the testing platform and the reagents to do antibody testing. Antibody testing actually was just approved, the first test, by the FDA I believe last Thursday. And so it's only been a number of days and it's not widely available. But when either that test or a subsequent test is available, we will be working on that. And the best use of the antibody test is not in making a diagnosis. What it does is test someone's immunity, whether they have antibodies and an immune response to the virus COVID-19. At that point, we would consider them immune. And I think that as we go forward in this outbreak and in this pandemic, finding out who has antibodies and is immune will be really, really important, and we'll be right there doing that.
Secretary, from the Philadelphia Inquirer, the state, the CDC, and other health officials recommend that people without cars contact their doctor to figure out how to safely get transportation to the testing sites. About 30% of households in Philadelphia don't have cars, and many people with symptoms haven't been able to get answers from their doctor, and some healthcare systems have deferred questions about transportation to the Department of Health. Who is responsible for helping people without cars figure out how to get care for coronavirus? And given that there are Pennsylvanians who can't get tested because they don't have transportation, do you plan to issue any recommendations for people without cars to talk to healthcare systems about best practices?
I think that this is a really good example of where telehealth could be really important. And we know that health systems and hospitals have expanded telehealth capabilities, and we're strongly supportive of that. And so the idea would be to call or use FaceTime or whatever, another type of media to contact your healthcare provider, to be able to discuss your symptoms, to discuss whether you might have COVID-19, and then to make the decision whether it's worth going out to get tested. As we've been saying, if you have a cough and a low-grade fever and you're not very ill, you're drinking well, you're able to control your temperature, you're not having shortness of breath or chest pain, then the idea would be that you would probably do have COVID-19 given the extent of the outbreak, and you should stay home and drink fluids and take acetaminophen and rest and then recover. If, however, you are having significant symptoms, then I would work on terms of going to the hospital. And, of course, if you have an emergency, please call 911.
Secretary, from WNEP, yesterday we talked with a man who tested positive for COVID-19. He's now recovered, but his wife is showing symptoms. She's been told that she would not be tested. Is there a limit of one COVID-19 test per household? And if so, how can the state have an accurate count of how many actual cases there are?
So there's no specific limit of one COVID test per household, but that does get into the idea of these probable cases, and that if someone has had COVID-19 and they've recovered, and someone in their family has similar symptoms, cough, low-grade fever, etc., and they're not critically ill, then you can make the assumption that they have COVID-19. They could be a quote-unquote probable case. And then I would rest and take the measures to make yourself comfortable until you also recover. Of course, you have to pay close attention to those symptoms. If you're starting to have high spiking fevers with chills, if you're starting to have shortness of breath, chest pain, labored breathing in any way, not able to keep down fluids or keep hydrated, then you would want to contact your healthcare provider, discuss the symptoms and whether you need to be seen and potentially tested. But then also, if you have an emergency, please call 911 to go to the emergency department.
Secretary, as a follow-up from the Tribune review, if cases are being undercounted statewide because those with mild symptoms are staying home rather than being tested, how will that play into the eventual decision to reopen the state?
So, and this relates to the previous question. We know in public health that there is an undercount. In fact, we know in flu season that there's an undercount. And Dr. Fauci and Dr. Birx have talked a lot about that on the national press conferences, that we assume that the true rate of COVID-19 is much higher than the one that we're reporting in terms of the number of cases. What we're looking for, however, and the purpose of the mitigation strategies and then the testing and then the preparation of our healthcare systems is for a potential surge of very serious cases that would require hospitalization and significant medical care that would then test our healthcare system. So more important than the exact number of cases, and I'm sure we'll look back retrospectively, especially with antibody testing, to see how many cases we had. But right now, the key is protecting our healthcare system so that that surge doesn't overwhelm us. And that surge would not be of mild cases, it would be of serious cases. And that just highlights one of the points that the Governor and I spoke about yesterday many times, and that is the importance of staying home. The best way to protect yourself, to protect your family, your community, and our Commonwealth is please stay home.
Secretary, from WNEP, now that the weather is getting warmer, how might that affect the spread of COVID-19? Do warmer temperatures make it easier or perhaps more difficult to transmit the virus?
Well, the simple fact is that we don't know. This coronavirus we call a novel coronavirus because it is new. and no one has ever seen COVID-19 before. So we don't know how this novel coronavirus will react to warmer temperatures. Now, we do know from many years of experience that influenza, the flu, is somewhat less transmissible in warmer temperatures. We will see if that is the same with COVID-19.
Secretary, we have several questions about racial disparities in COVID-19 from the Philadelphia Inquirer and Spotlight PA. First, other states are releasing racial data about cases and death. Does Pennsylvania plan to do the same, and if not, why?
Well, so in terms of our information system, it is very dependent upon the information put in. And one of the challenges we've had is that the healthcare systems don't tend to put in racial data, and so that's a limitation for us. But we are looking at different ways that we might get that information, and when we have that information, we will release it.
And then in terms of health inequities around access to care, cities like Milwaukee, Chicago, and Las Vegas have been cited as recent cities where these inequities are most present, according to a New York Times article. What is the current demographic breakdown in regards to race of confirmed cases? And if we don't have it, do you know when we would be able to start gathering that data? So
as I was saying before, I don't have that data, but we are looking at different ways to collect that data, and when we have it, we'll release it. Of course, health equity is a very important public health issue in general in terms of access to health care, and that's something the Department of Health has been concentrating on for a number of years now.
Secretary, from WNEP, life-sustaining businesses that are currently in operation required by law to supply masks and other PPE to all employees to reduce the spread of COVID-19 in the workplace. If they're not taking preventative measures as required, what can you do to stay safe since staying home is not an option?
Well, so a life-sustaining business that is not involved with health care would not be required to have PPE. Personal protective equipment would be for health care providers. But as you've been alluding to, we have recommended that when people are outside their homes that they wear a mask. The businesses are not required by law to supply masks. I think it would be great if they could. But I think for workers where the business is not able to supply masks, we have instructions that are pretty simple to follow on our website in order to make the masks. Then I think that you can use those homemade masks, which would be just as protective. Now remember, though, is that my mask protects you. Your mask protects me. So if a community is wearing masks, then the community is more protected.
From the Tribune Democrat, you've pointed out the positive cases and deaths are reported by county of residence, even if they were tested, treated, and died in another county. What about those who list Pennsylvania addresses as their primary residence but are diagnosed or die in another state? Are those included in the health department's report?
Yes. So if someone's primary residence is in Pennsylvania, and they are in a hospital in New Jersey or New York, and they tragically pass away there, that those cases would actually be counted in Pennsylvania statistics when we get that information from the other state. And the same is true is that if someone passes away in a hospital here, but they're a resident of another state, we notify that other state for their statistics.
From the Times News, some counties with local health departments have provided the municipality where COVID-19 cases have occurred. If a county has no local health department and a state representative wants the town-level data, what is the Department of Health considering releasing it?
So not at this time, but we are continuing to evaluate the data that we have and the data that we release that serves the public health. It's always a balance between privacy and confidentiality concerns and the needs of the public, and we're continuing to weigh that balance.
From WTAE, can you talk about some of the complexities of the data? It seems that we're getting conflicting messages when curves appear to be flattening in some areas, but we're told a surge is coming to others. What are some data points the public can look to and get the real story of what's happening? And what can you say big picture about what's happening in the state, more specifically Western Pennsylvania?
Well, so we look at our data statewide, but we also look at data in terms of the different regions of Pennsylvania. So what is happening in a certain area, such as the Southwest, might be very different than when it's happening in the Southeast, and they might show different curves. When we look at statewide curves, sometimes those differences even out, but the local data is absolutely critically important. So far, in the last number of days, we have seen a flattening of the curve in Southwest Pennsylvania, which is very positive. But you have to remember that even 1 or 2 or 3 days data is not conclusive. We tend to look at 3-day averages, and then we look at 7-day averages as well to see if those trends continue.
From WPXI, a follow-up question regarding nursing homes. If you presume all patients and staff are positive in a long-term living facility, how is that executed? Do all employees have to wear PPE at all times, as in an emergency room? And is there sufficient PPE to sustain this, given the reported shortages?
Well, if nursing homes have cases, and also other long-term care living facilities have cases of COVID-19, then they will need the proper personal protective equipment. And to date, we have the resources to be able to supply that. It is a constant balance with PPE. We have PPE stores coming in, and then we push it out to the healthcare coalitions to distribute to hospitals and health systems, as well as nursing homes and other long-term care living facilities. It's a constant balance, but to date we have sufficient supplies. And the Wolf administration has been looking for many ways to be able to get personal protective equipment, whether it's trying to order it from the national stockpile or looking to purchase it from other areas, whether in Pennsylvania, in the nation, or even overseas. And then we're looking at ways to possibly sterilize N95 masks and then be able to reuse them. So we're considering all of those options.
Secretary, we have a couple of questions about the community testing sites in Montgomery and Philadelphia from North Penn Now and Bucks County Courier-Times. Why are those sites being scheduled to close on Friday, and what impact will it have in terms of tracking the spread of the virus, making it more difficult, and tracking the peak?
So those two sites were set up a number of weeks ago in collaboration with the federal government and the Federal Department of Health and Human Services. And they provided the funding, they provided a lot of the materials and the testing materials, and they paid for all the testing. And they didn't provide that many staff, but we were able to get staff to be able to do that. As of, I believe, the 10th, the federal government is withdrawing that funding and their supplies and their testing materials. And so Philadelphia and Montgomery County has decided to cease those testings. We'll work with the counties to make sure that they do have adequate testing capability, and I know both counties have plans to be able to continue testing, but those two sites will close.
From Erie News Now, in Erie, Prescott was very busy over the weekend with people in the park. Is there consideration being given to closing places like this?
I'm not aware that the governor has any plans to close parks like that, but we are really relying upon people in Pennsylvania to do the right thing. The right thing is to stay home, or if you're going to go out to be active, to do that in a solitary way. And we strongly recommend that people do not go out and socialize together, even though it might be nice weather in a park, because that could spread this very dangerous virus. And so please do the right thing, stay home, and practice social distancing.
And then, Secretary, our last question today is from News Talk 104.1. In the healthcare worker and nursing home positive cases, has contact tracing occurred to find out how the virus was contracted?
Well, we will look at healthcare workers and long-term care living facilities. Sometimes we can decipher where the exposure was, but be honest with you, right now where we have widespread community transmission, sometimes it's not possible to do that. And so, again, most people in Pennsylvania, the vast majority now, are contracting COVID-19 through that type of community spread, and that type of specific contact tracing is not going to be productive.
Thank you, Secretary. That concludes our briefing for today. Our next briefing will be tomorrow. Thank you.